Brand name drugs are only about 20% of all medications, but account for more than 80% of the cost, totaling more than $482 billion per year. How do they do it? Keep watching. Pharmaceutical manufacturers continue to develop medicines that improve our lives. But for many patients, drug costs not only cause them to run out of money, in many cases, it causes them to literally run out of time. Until recently, over 100,000 people on Medicare were dying every year because they couldn't afford the prescriptions they needed. But there's good news. Recent reforms to Medicare mean they won't pay more than $2,000 a year for prescriptions. And for the first time, Medicare will negotiate what it pays for some of the most expensive drugs. But what about those Americans who don't have Medicare? Many are living on the edge, dipping into savings, or worse, skipping medications that keep them alive. Those with private health insurance from work or another source, and those who are uninsured, continue to face high and rising costs. How do drug companies keep prices rising and unaffordable? Time-tested sleights of hand that we call the tricks of the trade. Evergreening. In a standard drug life cycle, a successful medication grows profits over time. Eventually, its patents expire, and generics with the same active ingredients spring up at greatly reduced cost. To prolong profits, drug manufacturers first introduce one formulation of a drug, such as a 3 times daily pill. Then, just before its patent expires, they release a new formulation, like an extended release pill that only needs to be taken once a day. A generic version of the older formulation may be available, but most patients have switched to the new product, evergreening profits. This strategy increases drug costs and harms patients by withholding better versions for years to make more money. Patent thickets. Similarly, drug manufacturers create patent thickets by filing numerous patents on the same product. These discourage generics from entering the market due to the risk of infringement and the cost of litigation. The solution for evergreening and patent thickets? Generic approval reform. Only patents issued when the drug is initially approved or that address the core drug, not small changes in design, should block generic competition. Rebate traps. After years of sky-high profits, drug manufacturers want to prevent dwindling sales. Rather than publicly compete on price, manufacturers will often negotiate confidential rebates with insurers and pharmacy benefit managers, in exchange for the insurer refusing to cover the generic counterpart. Even with net price for the branded drug higher than the generic, insurers like rebates because they go straight to their bottom line. This results in less generic competition and higher patient costs. The solution? Reforms to ensure that branded and generic drugs compete head-to-head on prices. For example, requiring that insurance prefer generics when they cost less than branded drugs would ensure that patients get a fair deal at the pharmacy counter. Clearly, it's time to build on recent reforms that save money and save lives.